it wasn't all doom and gloom. This is Christmas Day in Elwa, and we had a nice carol service, and that was good fun. And this here is a survivor's wall. This was a guy who was a 500 survivor from that camp, and he every survivor put their hand onto this wall and wrote their name, which is really quite a nice touch. I put this up because I wanted to show just how long the disease can last in some body fluids. So we know that it can last for about 21 days after you've got become sick in your blood, but it can stay in semen for up to 90 days, which is why patients are really strongly encouraged to use condoms when they go out and when they're discharged, because we have incidents of people infecting their wives and girlfriends after they have recovered themselves and they've become ill. So we have to be really careful with that public health message. If you're asking why has he got a bowl of M&Ms here? Well, the reason I've got a bowl of M&Ms is because of a story that happened just before we got out. One of the nurses from Europe had unfortunately picked up Ebola while she was there, and there was a number of other staff that were working with her, and it makes you very nervous if you're working with people who've become ill, and they had shared a bowl of M&Ms. So 4 members of staff had to be evacuated from that Ebola treatment unit, where the expat staff, so a number of about 6 in there. So your behaviour, it's not touching, not sharing food or cutlery is really important. So it's not just the equipment you wear, it's the behaviour that you do is important as well. There was a need, there was a need for experimental therapies. That's why we were out there. There was a call in August for there's a lot of drugs that may be potentially of benefit. A short list of 50 were whittled down to 10. We went out to run a trial on one of them. I'm not going into details on that just because of time. We also took an opportunity of training local staff. We recruited our own staff to help us with the trial. These are all experienced nurses. We give lectures every day to local staff on Ebola and also how to manage different conditions, because part of our role there was to educate as well. And we really enjoyed doing that. I give a few talks to the community, and this is a group of about 400, part of a group of about 400. That was much easier. It wasn't as difficult. This is more easy, should I say, because that one was, I gave that talk with a loud healer, and I was talking about why we were doing a clinical trial there, and there's deep suspicion of that, so it was quite a fraught afternoon. I got quite a tight audience, so hopefully I get it a little bit easier here this evening. When I came back, I returned on the 10th of January to Edinburgh via Heathrow. This is in the middle of Pauline Cafferty, as you'll all probably have heard. She was ill around about the 30th of December, and so a wee nurse coming back to Scotland created quite a furore at Heathrow when I got there. So it took me away to a holding cell place, and they gave me quite a grilling, and eventually they sent me away with a little kit to monitor my temperature for 21 days. I had to phone in every day to the public health department, which was fair enough. People are very worried. Couldn't return to work for 21 days. Normally that wouldn't be a problem to me, but actually I was really keen to get back to my work then, and you just sort of got yourself back into sync of things again. The plumber wouldn't come up to my house for 21 days, quite truthfully, to fix a pump, so we had to manage like that. And I wasn't allowed to travel and stuff out with this here is a little scoop in case you're sick, so you can put these disinfectants on it. So these were the sort of things that we were given, and as I said, you just phoned in. 21 days is important, not because it's 21 days from me last being exposed, but it's 21 days from your last exposure to you being sick is the longest incubation period that's been found with us. So that's why the public health have a 21-day period on that. Just as I have to finish off, after post-Ebola, I have to think maybe about what's the sort of impact on it. In Liberia, before this outbreak, there were 50 doctors, 50 consultant grade doctors in the country for 5 million, 4.5 million people. 700 consultant grade doctors in Tayside. Of that 50 that were in that country, 25 of them had died by September because of exposure to this disease. And one of the hospitals that some of the staff had worked with, from 60 out of 300 staff had died in 1 month alone. So there's lots of reasons to admire the local staff to actually work in that environment. But there's also a need, I think, to actually come up with ways that we can help their healthcare system try to get back to some form of normality afterwards, and we're looking to see how we can do that. There's lots of orphans. This girl, Elizabeth, she is 32 years old. She's got 27 children now. She's set up an orphanage out there, and she's looking after these kids. And there's real stigma for the survivors as well, and also some survivor trauma out there that I think we want to be thinking about as we leave. Very good reflective piece. If any of you have time to have a look at it for MSF, just Google MSF and look at their reaction to the Ebola outbreak, because they're very self-critical about how slow they were to react as well. And time is death really in an outbreak like this, so you have to be really quick to react, and I think we'll be better prepared the next time this comes along. And that's me, thank you. This year I just put this up because I like this little welly tree. We went through a lot of wellies every day, so this was a wee thing for drying out our wellies when we had them washed. And that's me. Okay.